Now, ladies and gentlemen, today we have a guest here. Before I introduce my guest, ladies and gentlemen, if you've been following the dental talk, you know I've interviewed many Pakistani and mainly dentists from Lahore. And whenever I asked each of those dentists from Lahore, who is one dentist that inspired you during your BDS years? Ladies and gentlemen, all of them named numerous dentists. But I have interviewed five dentists from Lahore so far, and all five of them mentioned the name of Dr. Samir Qazi. And he is our guest for today, ladies and gentlemen, Dr. Samir Qazi. Now, my first interaction with Dr. Samir Qazi was back in first year when he came into our lecture hall and showed me this video of a maxillofacial surgery happening, and I fell in love with maxillofacial surgery right there and then. And that was my first interaction with him, ladies and gentlemen. He's an amazing academic, he's an amazing teacher, he's an amazing clinician. Those of you who know him know how much of an amazing personality he has, how much of an aura he has, ladies and gentlemen. I'll read out his bio to you. Dr. Samir Qazi, he'll be talking to us about his journey in dentistry. Dr. Samir Qazi was born in 1968 and did his BDS in 1990. He did his fellowship of the Faculty of Dentistry from the Royal College of Surgeons in Ireland, FFDR in oral surgery in 1996, and he also did his MPhil in Education, Leadership and Management in 2013. He holds keen interest in playing and making games. Ladies and gentlemen, this is all that I could find about him on the internet and when I talked to some people. And but he's a person you have to listen to. So without further ado, ladies and gentlemen, Dr. Samir. Okay. Hello and Assalamu alaikum, sir. Dr. Samir, it's a huge honor to be talking to you after so long. Hope you're doing well. How are you?
I'm very well, thank you. Thank you so much. Thank you for inviting me. It's a real pleasure
No,
to be
sir.
here.
It's an absolute honor to be talking to you after so long. I would like to start off by telling you a story, sir. So we've talked to many dentists in season one, and even in this season, we've talked to. I interviewed Dr. Bilal Sheikh. I interviewed Dr. Nasir Salim. I interviewed Dr. Asad Chatta, and a few others. And there was always this question that I asked them, that who was the dentist that you looked up to when you were in your final year, in your third year, or in your house job? And they took two to three names. All of them took two to three names, but all of them, every dentist from Pakistan that I've talked to or have interviewed, all of them, the mutual name that they took was the name of Dr. Samir Qazi. So, sir, I knew I had to get you on this platform, and so thank you so much for taking time out. That's a huge deal for me.
I'm humbled, absolutely. It's so good of them to remember me. But this sort of underlines the importance of having role models. I don't want to be a role model at all, because when you're a role model, you have to sort of be careful of what you do and say and how you act because you're
Absolutely.
being observed all the time. But it's so important to have these people. And
Absolutely.
yeah, I'm not happy being in this position, but yeah,
Okay, perfect. Sir, with your permission, should we start the interview?
Bismillah.
Okay, sir. Let's go a bit back in time. Sir, tell us a bit about yourself. Tell us, when did you know you wanted to be a dentist? And secondly, tell us about your journey through dental school. How were those 5 years in dental school like?
Well, I secretly wanted to be a teacher. My father was a sort of dentist in the army, so we were moving from city to city, and I had lots of different teachers and experiences. And whenever I told everybody about it, so I was discouraged. So when I started giving the answer that I want to be a dentist, everybody was very happy with it. So I must have sort of initially brainwashed myself into being a dentist from childhood. But I suppose my role model was my father. He had strong
Obviously.
principles. He had style. So he set such high standards that I'm still sort of trying to be like him. So I
Absolutely.
wanted to be like him. So I suppose that's when I knew that I wanted to be a dentist. But my mother wanted me to be a doctor. So when the time came, I got into both MBBS and BDS, but I didn't, submit the fees for MBBS.
Okay.
So she wasn't very happy with that, but I wanted to do it in dentistry. And dental school, my life journey through it, Dr. Chima was the principal. We had all of these very interesting people with me. My class fellow, Dr. Bilal, and all that you mentioned, but Dr. Noin Arshad was my class fellow, Dr. Tariq Ali Hassan,
Yeah,
Dr.
yeah.
Nabeen Afzal, all very established people, Dr. Nabila Mirza, Dr. Anwar Ali, who's heading colleges in Karachi. So I had a
Absolutely.
very interesting batch. I was the best graduate of 1990. There are too many details. You don't want to know any of those details. But I was the best graduate there, and then I did my house job, and it was a good experience. I think our standards in dentistry at that time were better than the educational standards now,
Okay.
and that's sort of depressing in a way because 30 years have passed
Absolutely.
and things are not really have they should have improved tremendously by now because we
Absolutely.
know so much more. But anyway.
Okay. Okay, sir. So let's talk about your early years as a registered dentist. So you've graduated final year, you're in your house job, and you don't know where you have to go from there. How were those years like, and how did you go about pursuing your passion from there?
I was one of those people who didn't know what they were doing, and I thought when I do my house job, I'll probably by the end of it I'll have an idea. So, but
Yeah.
I every specialty or department I went to, I liked it, so I wanted to do it, and then I go to another one. So I wasn't really sure, what to do immediately, and I was having a great time because I'd started to earn a bit of money, and I bought a guitar from my second pay. First pay you give to your
Wow.
mother,
Yeah,
and
yeah,
then
yeah.
second pay, I bought a guitar. I was having a great time, and I wasn't really I didn't really want to pursue. I was interested in oral surgery,
Okay.
more so maybe than other specialities. But my mother wanted me to be an orthodontist. So she said, "Ki apply karo," and everything. So um, they threw me out of the house eventually, in 93. I graduated in 1990, and they said, "Ki
Yeah.
go to England and do something on your own." And at that stage, I could only think of pursuing oral surgery. And I didn't know how to. So it was a very strange period because nobody had guided me. I was literally on the streets. And I'm not going to go into any details, but through a series of, very strange circumstances,
Yeah.
or maybe fate, if you want to call it, I ended up, with an already job in Ireland in oral surgery. And that's it. Then, then it was just, I worked very hard during that time period and somehow became an oral surgeon.
Okay.
So,
Perfect.
yeah, does that answer your question?
Yeah, 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 it absolutely does. All right. So, sir, when did you know?
Can I say that,
Yeah.
it's interesting how fate plays sometimes a role in what you want to
Absolutely.
do.
Absolutely.
So the circumstances on how I got into it were so strange, and sometimes you think there's a higher power or authority,
Absolutely.
controlling things.
Absolutely. Absolutely. Okay, sir. We know you're an oral surgeon. When did you know that you wanted to pursue oral surgery as a career? And how did you go about, and where did that passion start to grow? The love for oral surgery.
I okay. In what happened during my house job was
Mhm.
that there are a lot of people from abroad who qualified and came back and joined DeMont. One of them was Professor Adnan Shah, and then Dr. Mohammed Said was already there. So
Yes, yes.
these guys were totally inspirational for me,
We
and
just
they took me
interviewed
under their.
Dr. Saeed 2 days back.
Yeah, what an amazing person, because
Absolutely.
the amount of work Professor Said has done for this country selflessly. uh,
Absolutely.
I went as an examiner once to Multan, where he was heading, the institution there. And I was conducting vivas in a room, and it was adjacent to a room where Dr. Saeed was seeing patients, and there was a small partition between, so I could hear what he was saying. Oh my God, even at that stage, in that position, the way he was dealing with those patients and looking after them, it was just phenomenal. He's been a great inspiration, as far as oral surgery work is concerned. He did great service. So these people sort of, and I didn't do any minor oral surgery. They just took me straight into theater, and because I was interested, so that's where the passion really started.
Absolutely.
And
Yeah.
so that's where sort of I really got into it. And then when I got an opportunity in Ireland, I told you it was a series of circumstances. I wasn't sure what I
Yeah.
want to do, but when I fortunately somehow fate pushed me in there, then I
Yeah.
was so enamored by the whole thing. I would leave house at 6 a.m. I would come back at 11 p.m.
Yeah.
I was working day and night for years, and I was doing calls on the weekend to pay rent. I didn't have any money, And
Yeah,
so on the weekends, if I could get a call, I would do that. And then during the weekdays, working,
yeah,
stealing food
absolutely.
from the hospital, because I couldn't afford to buy it. So interesting
Wow.
time.
Yeah, that's an amazing story. All right, sir. There's this notion that the job of an oral and maxillofacial surgeon is much different and much more difficult than the job of a general dentist or any other specialty of dentistry. Would you agree with that, or is your opinion different from that?
It requires more dedication in some ways because you have longer hours and you have emergencies and calls
Yeah,
and things. But as far as the difficulty of the work, dentistry is just as tough as oral surgery, I would say.
yeah,
Somebody who's reasonably competent in both fields, would not find either one very difficult. So
absolutely.
once you got to go through that process, but once you learn it, I think I can't sort of differentiate because some of the old dentistry procedures, like doing a difficult root canal, is more difficult than
Abs-
many other things in oral
yeah,
surgery. Sometimes oral surgery में हम खोल के we have everything open in front of us.
yeah.
So no, but yeah, so I don't think it's more difficult. It's certainly requires much more dedication because the good points of the are you have regulated hours and things like that, which then this sort of goes towards the medical or surgical field.
Perfect, perfect. All right. So you did your MPhil in Education Leadership and Management in 2013. So what was that about? That's an MPhil I haven't heard dentists doing. So I would want to know that what benefits that did that MPhil give you individually and professionally?
The reason I was disillusioned by the whole educational system in 2010 and 11, and I wanted more professional development. I'd been faculty development in Lahore Medical and Dental College for the past, 5, 7 years before, there were medical educationists. I established the Department of, medical education there. And so I'd been doing this training and workshops. So I didn't want to do it in medical education. I was more interested in general education, so I wanted to sort of go there. And when I looked at the programs that were available, they seemed to be very interesting because I was getting to the stage where I was becoming part of management, as far as my work is concerned. And I thought that this, would give me a lot of interesting information.
Yeah,
My disability was about, my inability to bring about change, or to improve
yeah,
things or whatever. I didn't have any other
absolutely.
but I
Yeah,
wanted to learn how to go about doing it in Pakistan's environment. And that is why my thesis, while I was doing this, was on, change in dental education.
yeah,
And so I the theory, so I thought that it would help me. But while I was finishing it, it threw me out of LMDC. I don't know why. Then, so I never really anyway, it was a really, really interesting experience. The actual experience of becoming a student again was amazing for me. And I
Mhm.
learned a teacher can affect a student sitting at the, back of the class, because you tend to sort of sometimes forget that when you've been teaching for 15 years, which I had been.
Absolutely. Yeah.
So it was a really interesting experience, and it's really helped me with my teaching, I suppose, because I can empathize with students so much more now. Being a student
Absolutely.
is the best thing ever. If I could afford to do it, I'd again go and do a PhD now somewhere. But life is tough. You can't do everything you want to.
Wow, that's amazing. So I know you're an amazing academic. My first memory of interacting with you was when I was in my fifth day of first year in BDS, and you came to our lecture hall and you showed us this video of a surgery happening, and I fell in love with maxillofacial surgery right there and then. So yeah, I know you're an amazing academic. Many people claim that. Why did you leave academics where you could train dentists and impart knowledge to those dentists? Why did you leave academics?
This is the danger, you see, of exposing you to something like this. So I sort of exposed you to this, and this affected your life choices in some way. And sometimes even
Absolutely.
is supposed to inspire and motivate you, and sometimes you end up going in a direction where you don't really need to or want to, or it's not the direction you want to go in, but you're just doing that because you had that teacher, who inspired you, or so you start liking that subject. So this is the danger.
Absolutely.
must stop showing this video to first year media
No,
students.
you should. You should.
No, I'm kidding. But yeah, your question related to
My
this was,
my question was that because I know you're an amazing academic,
oh, why did
why?
I leave it? Yeah, it was a very difficult decision. Um, different uh, work ethic, different standards of ethics and teaching, and I wanted to work in an environment where I couldn't match that work ethic. So I couldn't get along with people or the organizations. I think maybe that's why I couldn't carry on. They made my life so difficult. They don't realize that I'm an asset. You just let me do my work, and I'll work for
Absolutely.
regardless of who's in charge, and I'll benefit the institution greatly. But somehow I don't think anybody is willing to take that risk with me for some reason. And you'll have to ask them, all those people who threw me out or pushed.
No. Okay, perfect. It's absolutely
But I
very
still want
sad.
to teach. I still want to teach. It's something that I miss, because the best
Yeah,
part is the student-teacher relationship. It's such a wonderful sort of experience. I had such
absolutely.
wonderful times. It was such a rewarding experience for me, and I still am totally grateful. For having had those experiences. And I sometimes think this was my purpose in life, to teach. This is what I felt as a child, that
Yeah,
I was here to do. And
yeah.
so it's sad in a way that I can't pursue it, but I've had to reprioritize and
So
give up on
my
certain goals in life.
my next follow-up question on that, sir, is that being an academic, how was your experience as an academic in Pakistan, and how did that change your outlook in dentistry or on dentistry?
Our outlook on dentistry, it can't be changed by something like that, I suppose.
Mm-hmm.
My experience was really good, as like just like I said, as far as students are concerned. People didn't like me for some, so that was an issue. But my
Okay.
outlook on dentistry, I'm still sort of at the same outlook. My whole aim in life at this stage in dentistry is to minimize complications.
Yeah.
This is to we try and keep on improving, because I'm dealing with it is very difficult.
Yeah.
So to sort of keep trying to improve, this is like a constant theme in my life. And then establishing these dentist-patient relationships is very important, I think.
Yeah.
In the long term, half the treatment that you can do as a dentist or a doctor is just by establishing that relationship and bond with them, and that takes care of half the thing.
Perfect, perfect. All right, sir. You're an inspiration. You're an inspiration for so many maxillofacial surgeons. I know so many aspiring maxillofacial surgeons who got into surgery because of you. To name one, Dr. Asad Chattha, he joined maxillofacial surgery because of you. I looked up to you when I was in my first, second year of BDS. You were our head of department at CMH. Sir, my question to you is, anyone who wants to become a maxillofacial surgeon in the future, what should the mindset of that young dentist be right out of undergrad?
I think first need to look at whether you really want to do it. It's a very difficult
Mhm.
specialty. In Europe, you're in your late 30s by the time you end up doing all of your training and qualifications. So
Absolutely.
sort of, get into this. In Europe, many places you need to be doubly qualified, and this is a
Yeah.
trend in places in the world. In America, it's so difficult to get into this specialty. They have a 5 or 6 year training program for this. So you need to seriously think whether you want to do it. And then if you want to do it, there's so many different paths, but I just want to say that please get out of Pakistan and work for some time in the system. Doesn't matter what that job is. Work in a different system, in a better, I hopefully better system, because you need to see how things work, and that exposure is critical for your long-term, thing.
Mhm.
So on this, have certain sort of goals, I suppose. 5 years, may 10 years, may what I'm going to do, and then work towards them. I would say to think very hard. Don't go into this specialty. This is what I do. I totally discourage potential people who want to go. I totally discourage them, and then there's few of them who say, okay, no, we're going to do it, and then you need to
Yeah.
support those. Some of them actually get discouraged, and that's very good, because it's not for
Yeah.
everybody.
Absolutely. That's amazing. All right. So many argue that maxillofacial surgery is now a saturated field in Pakistan and a field that isn't paying as much as the hard work that you're putting in. What are your thoughts and opinion about that?
Okay, so money has to be a fringe benefit of something that you really like doing. So we all need to make money enough to sort of survive. So a good oral surgeon or maxillofacial surgeon is going to maybe earn more than a good dentist. Or you can the potential for earning is a lot when you get to that state, but you have to work for 15, 20 years to get to that place sometimes, especially difficult. I
Absolutely.
think it's more difficult in Pakistan to establish yourself. So eventually you will earn enough if you're good enough. I'm sort of a little cut off with what problems these young maxillofacial surgeons are having about, not earning enough. And it's tough. I think it's tough for everybody. And it's very difficult,
Absolutely.
to get to that stage where you can sort of, you really paid for the service that you do. Pakistan,
Yeah.
unfortunately, this is the reality of life that, So my suggestion is become very good. Keep working at it because there'll come a day when you can charge as much as you like for a procedure and then patients waiting for you.
Perfect, perfect. That's an amazing answer. All right, sir. Let's talk about the undergraduate training of dentists. You were an academic for the better part of your life. What changes do you want to see take place in the training of dentists at an undergraduate level? And what role do you want to play in that in the future? I know you always put a huge emphasis on cross-infection control, medical and dental ethics, patient dealing, topics that the West is known for and not exactly taught here as subjects. So, why do you feel we are lacking in that, and what can we do better?
Oh my God, that's a really big question. So first part was about what changes I want, and so the list is too many. But you see, it's like I mentioned earlier. I think our standards have gone down. So it's not as if we're already at a high standard and we need to sort of go higher. We just need to get to a certain basic standard. That is
Yeah,
not rocket science. And again, you just need a group of really dedicated teacher and people at an institution who sort of set high standards that everybody wants to sort of come up to. So
yeah,
it's not very have all the facilities in all these colleges. They theoretically have the faculty and facilities and everything. So you just need that, the teachers to really work, and then that's it. I think in some places, we had a certain advantage 30 years ago that there was
yeah,
endless stream of patients. Even then, the students who didn't want to work were just standing out, in the sun, basking in the sun.
yeah.
Um, so sometimes I feel that there's not enough opportunity given to our
Mhm.
candidates who want to work to get enough clinical experience as opposed to, our training. But it's simple. You just need dedicated people teaching us. And I think this is a big problem. Our standard of a dentist who graduates from Pakistan is not really very confident in working independently. So this needs to change, and it's not very difficult. About the second part of your question, which is about these three things: cross infection ethics and medical ethics, and dealing with patients. You
Yeah,
see, you can't teach these things because everybody, if I ask you to write something on cross infection, you know all the theory. Similarly, you know the theory of how to deal with the patient,
yeah,
but
absolutely.
basically people are born with an innate knowledge of good and bad. There are a lot of gray areas in medical ethics, and it's the role of, I suppose, teachers to sort of present these situations to them and discuss all of that. But yeah, all these topics, you've got to again role model them. Is you give them
Absolutely.
basic knowledge, but then you need to have people who are heading all the departments, who working, your teachers, who practice all of these things. How to deal with patients? Are you dealing with
Yeah,
both private exactly the same way? If you're doing it, and treating them like human beings, then your students are going to do the same thing. Similarly, ethics,
absolutely.
communication skills, cross infection, you got to practice it yourself. You can't expect
Yeah,
somebody to do it if you're not doing it yourself. So role modeling is the
absolutely.
key to this again.
Absolutely. Perfect. Perfect answer. All right, sir. Let's move on to a question that I'm sure you've been getting a lot. I know you've worked on it as well. it's about the current situation. It's about the COVID-19 situation. It's a disease that has caused havoc in our profession. Things are getting back to normal. Things are getting much better now. Um, what is your opinion about that? How will COVID-19 change dentistry? How has it already changed? What are your thoughts about this?
Yeah, it's changed. It's totally changed dentistry forever. And some of these changes are going to stay in retrospect. If you think about it, are because the precautions that we were taking
Yeah,
for airborne infections were totally inadequate. We were
absolutely.
totally to viruses like influenza and all, and we were not taking adequate precautions. And the interesting thing is that these diseases they really help with cross infection or our standards in dentistry, because
Yeah,
in the early 80s they discovered AIDS, and that brought about a big change, and people actually started wearing gloves. I
absolutely.
studied dentistry when I in dental school we didn't wear gloves, and
Hmm.
so this sort of happened in the 80s. In the early 90s they discovered hepatitis C. Again, that was a big sort of push
Yeah,
towards cross infection.
absolutely.
But
Absolutely.
and now we have COVID, and the previous infections were not airborne, and now I don't see us doing aerosol generated procedures without N95 masks in the future. I don't want to even get influenza, with all of those aerosols. Now our knowledge is more, we know about it. So
Absolutely.
certain things are going to change. The whole infrastructure of the dental clinic has changed now. Ventilation is the key thing. We never talked about ventilation before. And now you need to ensure that you have, well ventilated areas, even the waiting area, the surgeries need to have an airflow.
Appointment
And then
timings, all of that.
G,
Yeah.
बिल्कुल appointment scheduling, the way we actually, these phone consults are very interesting because we were never using these before. And
Yeah.
patient needed to physically come in, whereas I think maybe 20-30% of, initial screening, a lot of time can be saved by, doing phone consults. So that may change a little bit as well. We have the whole setup of the dental surgery. We have new areas now, like donning and doffing, where you put on PPE, storage of items. Things
Yeah.
have changed a lot in history. The way we do procedures has also changed in the sense that now you don't want any equipment inside the room
Yeah.
because of what's being generated. You need to disinfect everything at the end. So all materials, things that needed to be during the procedure need to be outside the surgery. So this is a total change where things are put on trolleys or areas outside and then passed in when needed. So the way we practice dentistry has changed, and some of these changes are going to be long term.
But again, sir, in Pakistan, not all clinics will be able to do something like this. Am I right? Because there,
I did, I recently published two articles on COVID. One was a
yes,
needs
absolutely.
assessment where we looked at a number of clinics, and what their facilities were, and then we gave recommendations
Yeah.
on what we can do in Pakistan. Uh, you- it's a 40-page document, so I
I read
can't go
it. I've gone through half of it. Yeah.
Yeah, so but there are guidelines. So we try to develop guidelines for Pakistan, keeping in mind
Mhm.
our economic circumstances. So it's possible. It's possible to do
Okay.
it, but it's massive training is needed on a large scale. There are a number of issues that I've identified in these documents. So it's an uphill battle because nobody in the
Absolutely.
government is interested to
Yeah.
really pursue this, for dentistry at the moment.
Perfect. Perfect. All right, sir. This is a question that Mars and I both wanted to ask you, and we know this about you. Now, you have a very well-rounded personality with many talents like software programming, music, writing, photography, many talents. I know I've seen all of them. I have even played a game that you programmed. I played it on Mariam's laptop. So yeah, I know you're a pretty talented man. What I want to know is, or Mars wanted to know, is that a lot of students or professionals believe that committing to a healthcare field makes work-life balance difficult. What do you have to say about that? And how do these extracurricular activities or extra professional activities help you in, you know, staying sane in a way, or, how do they help you in your professional or private life?
It's very difficult to balance, this work, uh, uh, leisure, recreation balance. It's very difficult, I think, in life for everybody.
Yeah.
And I think I'm at fortunate stage in life where I can do it, but this is after 2 decades of a lot of hard work, I suppose. And so I
Yeah.
feel very good, but I think we all have interests, and you can't wait for a day to indulge in those interests. Life is very short. We don't
Absolutely.
know what's going to happen in the future. So don't wait for a day. Just do it. Everything happens together at the same time. And I think we all find that the more work we do, the more productive you become, and the more sort of work you can do. This is at least my experience in life. So everything has to sort of, so even in the years when I hadn't sort of
Yeah.
deprioritized my life so much, I was continuing with all of these activities to a lesser
Yeah.
extent. Because yes, you got to stay sane, and you've got to sort of think of what are the really important things in life. And I sometimes,
Absolutely.
about if the world is going to end tomorrow. I have 24 hours. What am I going to do? And for me, I would just spend this time with my loved ones. There's nothing else that's really. If
Yeah.
I want to do go bungee jumping or do some sort of bucket list thing, but really I'm a simple person, and I find that these relationships are the most important things in life. So you got to prioritize your life accordingly to the situation, your own circumstances, but I think relationships need to be sort of high up on that list.
Yeah.
And work is important, but at the end of the day, you're not going to go say, okay, last 24 hours I'm going to go and
Yeah.
maybe do, no, maybe not, unless it's to relieve pain or to really help somebody.
Yeah.
So, or you
Absolutely.
don't want to spend it with your workmates, I don't know, friends, loved ones.
Yeah.
So,
Perfect. That's
yeah,
perfect.
reprioritize. If you can, reprioritize. Life is tough for everybody. But yeah, don't wait for a day. Everything should happen at the same time. And human being, at least
Yeah.
the way my mind needs some sort of creative activity on a daily basis. Otherwise,
Yes.
I just sort of, I can't function. So you need to innovate, and you got to do it in your own way.
Perfect, perfect. All right, sir. Talking about programming, we see that that dentistry is going towards a future. We see that dentistry is going towards a future that is going to be governed by artificial intelligence. Now, I've talked to many dentists about this. There's so many artificial intelligence startups coming up in dentistry. What excites you about dentistry in the future? Where do you think dentistry is going in the future? I asked Dr. Tucker this question, where do you see dentistry going, because he's been in dentistry for over 50 years. He said, I want dentists, or I want scientists to come up with a solution to caries, to the treatment of caries. There's no treatment to caries. I think that answer was very smart. What excites you about dentistry? Where do you think dentistry is going in the future?
Some of, interestingly, dentistry, a lot of things the way dentistry is practiced now and is going to be practiced in the next few decades involves physical presence of a patient dentist. So, artificial intelligence, you can't have robots coming and doing this thing. You still have all
Absolutely.
personal contact. Um, I'm sort of looking forward to a day that I can implant a tooth bud instead of doing a dental implant.
Yeah.
And then I'm looking
Okay.
forward to a day where cancer is treated by genetically or something. You give them an injection, a pill or something, and it goes and on the genetic molecular level, it's sort of dealing with it rather than doing these surgical procedures. Uh, I suppose, like, Dr. Tucker said, caries, something simple that, solve this, is going to really help people and avoid a lot of other stuff. You don't need that. So I think, but I'm not going to see it in my lifetime. So it's okay.
You never know, sir. The world is going really, really fast. So, and there's research happening on this. In implanting a tooth bud into the mouth. I think there's research. I read up on this. So there's probably research happening on this.
There's a lot of work being done. So
Yeah,
yeah, there's hope. There's hope, but I don't think we're going to see it very soon.
obviously.
Just
Okay.
imagine
Yeah.
avoiding all of those invasive procedures by just giving a small pill or something. So yeah,
Absolutely. Absolutely. Okay, sir.
oral surgery hasn't changed much. I'm still using that same old drill that I want, to take out wisdom teeth. So
Yeah.
there have been our understanding of biology and how things work, especially how bone, regenerates. And there are a lot of
Yeah.
interesting things, that have come up. A lot of other specialities have changed a lot, but oral surgery is still, picking up that blade
Yep,
and that.
absolutely. Absolutely. Completely agree with you, sir. All right, sir. We're moving towards the end of our interview. We asked our followers on Instagram to, we told them that we're interviewing Dr. Samir and they should send us in, send in questions that they want to ask you. So we have some,
It's a
we have
rapid
some,
fire round or something.
no, it's not a
Sorry.
rapid fire round. It's just simple questions that we wanted to, that the audience wants to ask you.
Fire
All
away.
right. What's your personal favorite form of surgery, or maxillofacial surgery? Would it be treating cancer, orthognathic, traumatic surgery, taking out a tooth, taking out an impacted tooth? What's your favorite form of surgery?
I like dental alveolar surgery.
Yeah.
So yeah, I'm happy taking out teeth, and I'm happiest when I'm teaching students how to take out teeth.
Wow.
I I can't deal with cancer. I
Yeah.
find very difficult to draw that line between sympathy and sympathy. It's easier said than done.
Absolutely.
And I love orthodontic surgery, and I would still like to do it, but it needs that teamwork, which
Yeah, it's a hospital based. Okay, perfect.
really,
Um, what do you
yes.
think is the future of maxillofacial surgery?
Yeah, this pill that'll cure cancer. you know,
Okay.
because for the foreseeable future, I think things are not going to change too much. But I'm looking forward to the day that we genetically treat these problems.
Perfect. Perfect. All right. What's the most unique surgery that you've ever done?
Unique is a strange word.
Mhm.
I sup- Maybe a back hair correction or something that's not
Okay.
only as such. What happened was that we had these cases. My consultant in Ireland had a few cases, private
Yeah.
cases of back correction.
Yeah.
So
Yeah.
he asked me to sort of experiment with it. So I read it from a journal, from a 1930s
Uh-huh.
journal, and so I suppose that was quite unique. I suppose in this whole line, I did a lot of
Mhm.
procedures in my life. My first cleft lip and palate, my first carotid gland, my first implant, which was an extraoral implant. It was just books, and reading from book and doing these procedures.
Yeah.
So sometimes you don't have people, even when you're working abroad, who's going to train you, and you've got to step up and just do it. Read it in a book and do it. So I
Perfect.
did a lot of those. I'm quite proud. They're not maybe very unique.
That's it.
Another
No,
another one,
yeah.
if you don't mind me, another one. This is the circumstances were unique. There was this guy with TNJ ankylosis, an 18-year-old patient, wonderful boy, and we got into theater finally. Intubation is very difficult because you need to do a blind nasal. They
Yep.
don't have those fiber optic things. So the anesthetist left the theater and would refuse to put him under. And the boy, it had taken a few months for him to sort of get him to that stage. So, and they said, okay, if you can do a tracheostomy, we'll put him under. So it was a strange situation, and I discussed with the patient, and he said, okay, let's do it. So I did a tracheostomy under local anesthesia,
Wow.
and it was a strange and unique sort of experience, and that really helped eventually to get support, to start doing all this. At the beginning of our work in Gufi Hospital, so we didn't have very much support. It's a long story.
Yeah.
So that was a really interesting and strange procedure.
That's
So I
that's
hope I
amazing.
hope that answers.
No, that definitely answers my question. Sir,
The
second last.
patient, can I say, he was such an amazing patient.
Yes.
You have to thank your patients over the years because complications happen,
Yeah.
and they're individuals, they're peoples, and they suffer, and a lot of them are very sympathetic and very understanding in these situations. And then the patients like these, I remember throughout the years who were just amazing people, willing to
Mhm.
go through a lot sometimes. So hats off to that patient, amazing boy. Sorry.
Amazing. Perfect, sir. All right. Second last question. One time you made a mistake during a surgery and learned from it.
Oh yeah, well, I made hundreds of thousands of mistakes. And
Yes.
so, but the one I can't sometimes forget is that I got really good at doing sagittal split osteotomy. I was
Okay.
doing 2 a week, and it was a breeze for me, and I was teaching people and everything. And then one day, while I was doing that split, I was a little cavalier or aggressive,
Uh-huh.
and I did split. I should have been more careful, and I saw the nerve, the inferior nerve, sort of stretching and then tearing apart. And I could have easily have prevented it. Was I think I should have. It was just being when you're young,
Yeah.
you sometimes think you can do a lot, and you sometimes not as careful. You get sort of. So I still can't forget that. So it was a
Wow.
mistake that had sort of benefited a lot of patients in the future, I suppose. So this is what it is. We have to be thankful to these patients that but we need to learn from it. You see, if I didn't learn
Absolutely.
after that, it's never happened. It will, inshallah, never happen again. And a lot of other procedures, I've been very careful as well now. So some patients suffer, and their suffering should not go to waste.
Yeah, absolutely. Perfect,
We need
sir.
to learn.
Last question to you, sir. Your advice to aspiring female maxillofacial surgeons.
It's the same as to male. I know it's more
Yeah.
difficult for
Yeah.
that balance. Achieving that
Absolutely.
balance is much more difficult. We have expectations of them as a society. The prejudices. There's so many issues.
Yeah.
But my advice is the same, which is, think very carefully before you get into the specialty. And then once you're in, get some experience abroad. Yeah. So
Perfect.
it's going to be tough. It's tough.
Perfect, sir. All right, sir. Another question, last question, just came up right now. Someone asked, sent it to me. According to you, what is the one thing in dental schools of Pakistan that must change right away?
Oh, no. Oh, my God. Uh, Curriculum? I don't know, teachers? It's two separate answers. I can't. There's some wonderful teachers, there's some wonderful people, and this is why, you see, I always believe that in every organization or institution, there are a few percent people that are sort of keeping it going. So
Yeah.
they're good people, and so I just wish that everybody would sort of, do justice to their job. I
Absolutely.
was talking about my father, and he used to think of work as religion, as ibadat,
Yeah.
to
Wow.
submit. Islam is about submitting to the will of God. And this has to reflect in your work ethic and your work practices.
Yeah.
So I don't know. I think I'm digressing. So
Perfect. Perfect.
yeah, so I
No.
think curriculum, the answer is
Okay.
curriculum.
The answer is curriculum.
Let's stop
Sir,
the
we end our interview on this last question. What do you think about this small startup of ours, and any advice that you would like to give this startup, the dental talk?
I'm I think I'm looking forward to what you'll do. I think this is maybe the phase that where you said had a look at your objectives, and so your objectives say that you're going to do something and use this platform for educational purposes and so forth. So I'm really interested to see what you do with it. One of the things that I don't agree with totally, one of your objectives is that you said that this is going to be a platform for marketing and advertisement
Yeah.
of different products. Now, I think you need to be very careful. I'm not saying don't make money. I want you to make a huge amount of money somehow, and make better decisions, interview better people, and make a lot of money somehow. I don't know how you're going to do it, but I, I don't know. I would not put that in my objectives upfront, okay, as a platform,
That's
because
yes.
the whole world has gone in this direction where you can't see something on a screen without 5 ads popping up all around you. And
Yeah.
so be subtle about this marketing thing. Do
That
reviews of different things. There are ways of
yeah.
doing it
Yeah.
more
Yeah.
ethical. This is a gray ethical area.
Thank you
in
so
my
much for telling us that. Thank you so much. That your advice means the world to us, sir.
So, but I wish you all the best. It was really enjoyable. Nobody's interviewed me before. I think this is the first. So
Okay.
first experience is always interesting.
Yes, sir. No, sir.
And I'm
Thank you
so
so
happy
much.
that it was you, Dr. Paracha. It was you because we met so many years ago. We
Yeah.
went to that walk. We worked together in that
Yep.
Olympia. So it's such a pleasure to be here with you today.
So it's always a pleasure talking to you. It's honestly an honor to be talking to you right now and have interviewed you. I learned a lot. I've learned a lot from you, and I learned a lot right now as well. Thank you so much. Thank you so much for taking time out. First, I hope to see you soon on this platform once again, sometime in the future.
Thank you for your kind words.
Thank you. Take care, sir. Take care and stay safe.